Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the immune complexes? What are the immune complex diseases with hypocomplementemia? Okay, complementemia. That is, what are the immune complexes which are associated with decreased complement? Decreased complement is seen in systemic lupus erythematosus. It is seen in vasculitis conditions, like especially it is seen in hypocomplementememic urticarial vasculitis. It is decreased in complement hypocomplementememic urticarial vasculitis, or it is also decreased in polyarteritis nodosa, especially which is hepatitis B associated polyarteritis nodosa. It is also associated with glomerulonephritis, especially like it is associated with post-streptococcal glomerulonephritis, or it is associated with membranoproliferative glomerulonephritis, or it is associated with cryoglobulinemia. Especially it is associated with cryoglobulinemia type 2 and type 3. Okay, then decreased complement is also seen in bacterial endocarditis. Decreased complement is also seen in serum sickness also.
thank you and thank you for watching.